Hello, my name is Sasha D'Souza, and I'm the Senior Vice President of Talent Initiatives at Toronto Finance International, or TFI. For those of you who may not be familiar with us, TFI is a public-private partnership between Canada's largest financial institutions and the government, working together on initiatives which drive the growth and competitiveness of the financial services sector. And we're the lead voice for the promotion of the Toronto Financial Centre around the world. Welcome to the latest edition of TFI Talent Talks, a webinar series that promotes discussion, learning, and the sharing of emerging best practices in talent management and workforce strategies in financial services. In today's session, we explore the timely and multifaceted topic of safe return to work. The global pandemic has changed the way that we work, as we've highlighted and discussed in previous webinars. And one key change that financial services organizations have consistently reported is the laser focus on employee well-being. Employers have added more resources and supports to help employees navigate through this past year, and leadership styles have become much more human-centered, emphasizing empathy, connectedness, and inclusion. So as the number of COVID-19 cases fall and the Canadian vaccination program gains momentum, financial services organizations are contemplating various return to physical workplace scenarios, all centered around the well-being of their workplaces. So today, we have three subject matter experts from different domains who will share their perspective on the top considerations for employers and employees as the financial services sector plans for a return to physical workspaces. Our first panelist is Rob Carlisle. Rob leads Sun Life's HR analytics, IT, organization design, and risk management function. The team's primary focus is the targeted use of technology to improve the decisions of individual employees, managers, and leaders. Over the past year, Rob has also coordinated HR's response to the COVID-19 pandemic and return to office planning. In addition to his role at Sun Life, Rob is the chair of the Canadian Chamber of Commerce's HR Policy Committee, a member of the Labour Market Information Council of Canada's National Stakeholder Advisory Panel, and formerly the Canadian representative to ISO's Human Resources Management Technical Committee. Our second panelist is John Craig. John is a partner with Mathews, Dinsdale, and Clark, leading global HR lawyers. He's a recognized expert in labor, employment, and human rights law. His practice is focused on providing strategic advice to employers and representing them before arbitrators, labor relations boards, human rights tribunals, and the courts. He's a leading federal sector labor lawyer and has been ranked in major legal directories, including the Canadian Legal Lexpert Directory, Best Lawyers in Canada, Who's Who Legal, and Chambers Canada. And our third panelist is Dr. Thomas Tenkate. Originally from Australia, Thomas joined Ryerson University in 2011 as the director of the School of Occupational and Public Health, completing his term in June 2020. He continues to work with the school as an associate professor. Thomas's experience spans both academia and industry, and he's consulted with legal firms, government agencies, old age facilities, and schools in the areas of food safety, environmental health, occupational exposure assessment, and risk management. He has qualifications in occupational health and safety, specifically occupational hygiene, management, education, and risk management, including a Doctor of Public Health from the University of Alabama. Welcome, Rob, John, and Thomas, and thank you for joining us. We're excited to have such a diversity of perspective on this panel, and because it's a complicated topic with a variety of angles to consider when developing a strategy and a plan. So let's get started with the employer lens. Rob, the first couple of questions are for you. How has the pandemic changed our view of work and physical workspaces? And leaving aside the legal considerations for a moment, we'll get there with John, what strategic elements should employers take into account when developing a safe return to work plan? And you're on mute, Rob.
Thanks. Thanks, Sasha. I think the biggest thing we've really learned about the last the last year is how many things we thought were impossible or difficult to do have become possible. And the number of, for a moment, but most of our employees around the world actually worked in an office. And in a relatively short period of time, under a month, we had 98% of our employees working effectively remotely or from home. In fact, we're probably close to 95% over one weekend. And so it's pretty remarkable how quickly that could change. And interestingly, with an enormous focus on employee well-being, ensuring that people were productive, and focusing on what we needed to do and not on some of the work, the work that I think was optional but maybe relatively low value, was actually a fairly good opportunity for us to streamline jobs and the work that people got done. And with that, we actually found a fairly large improvement in engagement and less micromanaging, and really a lot of positive things that we learned through the pandemic in the early days. What we have found over time, though, is that organizations that worked great for teams that knew each other. And as new employees join the organization, as people move from one role to another, what became more challenging was actually how do you maintain that sense of camaraderie, team effectiveness, because we didn't really have tools to build this virtually. So those needed to get built. And I think that that's one of the really big things that we've learned, sort of really summarize that getting work done didn't really become much harder, but creating effective teams and social interaction across teams and an emotional attachment to work became more challenging, and we needed to find new ways to do that. And I think that as we think about creating a safe, return to the office plan, or maybe even reopening offices, because I don't think we're going back to where we were. A little bit of when people talk about return to work or return to office, there's sometimes almost an implicit thought that we'll be going back to where things were before. I don't think that's going to be possible. Employees have new strong preferences to higher levels of flexibility. And any employer that tries to take that away, I suspect is going to find a pretty negative reaction from most of their employees. So if we think that we're going to sort of reopen offices and they're going to be new, I think that's really the biggest thing to figure out is what needs to happen and how to make that effective. If offices are around convening and collaboration and building team effectiveness and not really a place where people go for heads down individual work, how does that change? What are the logistics that are required? Does real estate design need to be different? How do you make that equitable and fair and seen to be equitable and fair? And what does that demand of leaders so that they're modeling the right behavior? If leaders come in all the time, does that mean their direct reports want to have face time and have proximity and they come in and you get this say-do difference or gap that's really threatening, where we say you have flexibility, but all the leaders come in and you feel obliged to come in as an employee. That's really not the kind of gap we want. So I think those are the types of really strategic factors to think through, is that as we return to the office or reopen offices, it won't be the same as the past. And how are we purposeful about that? And a lot of the promises that employers have made in the last year, how do we live up to those? Because it was easy to make promises while everyone's working virtually. As we get more and more in the office, we actually have to deliver on those promises, and that's going to be really difficult. And so that would really be the key thing to focus on, is what commitments have you made and how are you actually going to live up to those?
Thank you for that, Rob. That's actually excellent context, and you touched on so many different things that we're going to be able to delve into. And I think it's a good segue to the next question, which I want to give over to John. John, can you talk about some of the top legal considerations that employers should consider when creating these return to work plans? So Rob's given us some great strategic context. What are the legal implications to all of this?
Okay, thank you, Sasha. There are actually quite a few. but I'll try in the time that I've got to give a fairly high-level summary of what we should be thinking about. And the top legal considerations mostly relate to occupational health and safety law and the duty on the employer to maintain a safe workplace for all employees. There are other considerations, legally speaking: privacy, human rights, the duty to accommodate. I think we'll have a chance to get to that a bit more later. And I don't think many of those on this meeting are unionized, but if you do have unionized employees, then there's a whole other area of law you have to consider revolving around collective agreements. So keep that in mind. But a couple of points I want to make just to sort of give you the highlights. The first point I want to make from a legal perspective is that at this time, remote work is still required and preferred. From the beginning of the pandemic, it was thought that the best way to prevent COVID outbreak in the workplace is to keep employees out of the workplace, if and when possible. And many employers were successful in achieving that. Rob talked about Sun Life success, for example, really interesting pivoting and working remotely and reorganizing the workplace with a lot of success. And in many cases, productivity hasn't suffered. Although we're looking at a staged reopening and hoping for a return to work, I think most of us are, the current regulation in Ontario, which is under the Reopening Ontario Act, continues to require employers to maintain employees in remote or at-home work if that's possible. It actually says, this is section 2.1 sub 1, each person responsible for a business or organization that is open shall ensure that any person who performs work for the business or organization conducts their work remotely unless the nature of the work requires them to be on site at the workplace. So requires is the word that's currently being used. That's a high standard. It basically means that unless you can't do your job remotely, you have to be working from home or outside the workplace. And that also means that if your principal concern in getting employees back to work right now is productivity, you're going to have to wait because it doesn't meet the requirement of requires. So caution should be exercised. And of course, we don't really know what the regulatory framework is going to look like as we move forward. And so we're all going to have to look at that very carefully to see what the provinces or the federal government tell us we should be doing, or even municipal public health authorities telling us what we should be doing going forward as reopening takes place. That's the first point. Second point, COVID safety plans that have been developed pursuant to occupational health and safety law, they have to continue to be followed in the workplace, and that's going to be in place for the foreseeable future. Every employer should have a COVID safety plan in place dealing with COVID-19, and those protective measures must be kept in place. And that's even if employees have both vaccinations. Just because you're vaccinated doesn't mean you can lift these kinds of restrictions. Precautions have to be taken, all the ones that we're already very familiar with. Barriers, wearing masks, social distancing, all of that remains in play. Visitors to your business will also have to meet these kinds of security and safety measures. And where physical distancing can't be maintained, there may be more reason to implement rapid testing, to consider mandatory vaccination policies. Although testing and vaccination raise potential human rights and privacy issues, the current legal position hinges on the science, and it does seem to be the case that there is some room for employers to have those kinds of policies and to live up to their occupational health and safety obligations in that way. Third point, it's time to plan cautiously for a full return to work. Now that more employees will be returning to the workplace, it will be a good opportunity, I think, to review the physical workplace. And Rob touched on that. Consider your physical barriers, your ventilation systems, spacing between workstations, spacing between offices, the design of common areas, hallways, and corridors. Also consider a staggered reopening is likely. You'll want to ease employees back, perhaps asking them to work from home some days, attend to the office on others, variations in shifts. There could be a fourth wave, even a fifth wave. You want to maintain absolute flexibility in the short to mid-term in case you need to revert to the work from home model. And consider as well how employees will be screened following international travel as borders open up. Employees are going to be taking vacations, and if international travel is permitted, then you will have employees leaving the country on occasion, and you're going to want to figure out how you're going to address that, particularly when quarantining is going to be lifted. It seems like that's going to happen fairly quickly. But you may want to have certain rules in place for employees returning to your own workplace. They may have to work from home, for example, for a period of time after a trip before they can come back to work. There are also, I just want to mention this at the very end of my answer, there are some great resources you can access. Of course, you can always talk to your lawyers, your labor and employment lawyers, I'm sure will be very happy to help. But the public health authorities are publishing and updating information all the time. I look regularly at Toronto's and Ottawa's public health authorities to see what they're saying as they update information. There are a number of resources out there that are available to you to get ideas, to figure out the lay of the land and move forward. So consider those resources and how easy those are to access. Okay, thanks, Sasha.
That is a great legal overview, John, and a lot of great content there. So Thomas, the next question is for you, and I think it's going to really round out this initial introductory discussion, and we kind of bring it back to that what it all comes down to, which is the employee well-being aspect of it. So, given the realities of the global pandemic and the public health directives that have been top of mind for the past 18 months, and some of the stuff that John just mentioned, it's clear that the health and safety of employees is the cornerstone to any successful return to work plan. We know that there are measures we can take to control the spread of the virus, but what are some strategies that employers can implement to ensure employee well-being more broadly? And I know Rob alluded to it in the beginning, and then John continued it. So round out the discussion for us.
Yeah, great. Thanks, Sasha. Yeah, I think overall we have to think about health and safety of all of the workers. So at the moment, we have people in essence on a temporary arrangement working from home. But once we move into an arrangement where we have people on an ongoing basis at home, as well as some people in the physical workplace controlled by the employer, then how does the employer ensure their duties and obligations for protecting the health and safety of all workers? And so this is both the physical safety in regard to infection control, but also psychological health and safety. And we know that it's been a challenging time for everyone over the last year and a half, particularly sort of trying to balance work and home life and various roles, and kids at home with school and that sort of thing. And so then you have to think about moving forward. If you've got employees still working from home, they're still trying to balance a lot of that, but there's also ongoing issues of uncertainty, questions about workload and working hours, and the aspect of if people are moving, say, permanently to sort of at home or mobile or work versus in the office, is that a change of work roles? And so there's potential psychological health and safety issues around role ambiguity, potential lack of control. There's the social support aspect in a workplace where you have that social support network, that aspects of isolation for people working from home. And so there's a whole range of things there that we have to keep in mind in regard to psychological health and safety of employees, who are coming back to the workplace and anxiety and uncertainty about how safe they are whilst they're in the workplace, but also those staying still working from home based on their work roles. So I think that then leads to enhanced roles for the employee assistance or wellness programs to provide enhanced support and counselling, looking at altered work arrangements potentially, and really sort of trying to support workers in regard to issues of anxiety and workload and work-life balance. And I suppose the last thing I'd sort of come to is, and I think Rob initially sort of talked a little bit about it, is around organisational culture. And from a safety perspective, we always think about safety culture and how is the organisation managing its safety culture, and how is it ensuring a safety culture within its organisation. So then when we move into this sort of split or hybrid approach to work arrangements, how is an organisation able to maintain that safety culture for people who are working from home, particularly, and in work, so their workplace is not a workplace controlled by the organisation, I think that then ensure so basically, safety culture is really driven by supervisors and the role of the supervisor, as well as as well as communication. So there are broad, a range of things that I think are considerations.
Thanks for that, Thomas. And let's continue along this thread of the employee perspective. So we've kind of segued into that, and I'm curious, and I'm sure the audience is too, Rob. How are we going to, as organizations, balance employee preferences with business directives? So, we're talking about the concerns employees may have about returning to the physical workplace, and we want to accommodate them and make them feel as comfortable as possible. But is there going to be, is there some complexity here, some challenges here with balancing against business directives? And what can we do as leaders and teams? What can we do, and how can we think differently to achieve this balance?
Yeah, I think, Sasha, it's a really good question, and it's a tricky one, because I think in the desire in many of the conversations that I've seen played out in the media, and how some of the particularly some of the FIs based in New York, as they're a little bit further in the reopening than we are, how there's been a huge variation in how companies have tried to balance this off. So I think the first thing to recognize, there isn't a right way or a wrong way. There's a lot of different approaches. I think it's also important to think that workplace practices were not perfect before the pandemic. And trying to just return to how things were is probably a bit short-sighted and not taking advantage of what we've learned recently. I think the other maybe a bit of a disconnect that we've had in the past is FIs have been slower than some other industries and really evolving to sort of more modern, agile workplace practices that have been, maybe the tech firms have led the way, where there's a lot more about employee empowerment, flattening organization structures, and having leaders take more of an enabling approach as opposed to being directive. And if you're thinking about changing the performance management systems and the way we get work done, that actually creates a lot more flexibility, where you don't need to be in the office, you don't need to be supervising work as closely, because you're really defining work in different ways and giving employees a different structure to work within that doesn't require sort of constant oversight and like visual inspection of how they're working. So if you can get that done, or working on that, then employee preferences and flexibility becomes a lot more possible. So I think that that's an important thing. But if you're locked into a mentality, we're going to go back to managing people and performance and work exactly how we did before the pandemic, then you're probably going to end up returning back to the office and you'll have about as much flexibility as you had before. So I think that's really important. I think the other element too is that employee preferences, many employees know what they need to do to get their job done. And and that's really an element of it, is that are we trying to manage style, or are we trying to manage results? And if you're in the past, we haven't necessarily, as employers, necessarily been as good as really holding people accountable for results, because those can be full and frank discussions. And managers may not always feel that they're backed up, or they personally don't have the training, or maybe sometimes it's the confidence to confront poor results and then be able to how to coach people towards productivity. But if you're able to do that, then you don't have to focus as much on managing technique. And if you're going to manage technique, you've got to be there watching every detail. A little bit maybe more of how if you're a tennis coach, you'll have to watch somebody practicing serving and you watch it in detail. Well, that's a little bit different than, we don't need to manage that level of technique in most work environments. We can manage results. Not always, people who are new in role, somebody that's joined a contact center for the first time, you might need to manage their technique, and that would require a place where you would need to be, very carefully monitoring how their conversations go and giving very active coaching. But once people are into a role, generally you don't need that. So I think that maybe the flexibility is less on the employee and maybe more on the manager. And how do managers become more flexible and more accommodating of different styles? And so I think that might be a different lens to take this, rather than saying that, because if you do that, then I think the flexibility comes with it.
I love that, Robin. I'm a huge champion of managers needing to style flex because, and I've said that for years to my staff, that it's up to us to flex our styles to get the best out of employees, not them to flex to us. So I love that. Audience, I just want to remind you, and I don't even know if I've said it in the beginning, but we do have time at the end for Q&A, and we'd love to get your questions. So please feel free, as we're going along, if something comes to mind, to put your questions in the chat box, and we will get to them. John, I want to turn it over to you. So we've been talking about this idea of employee preference, and that's the ideal, that we can accommodate employee preferences. But let's talk a little bit, let's bring it back again in those situations where that's not possible. What are the legal considerations that employers need to be aware of? So does that, we mentioned duty to accommodate. Does the duty to accommodate apply to situations where an employee is uncomfortable returning to the physical workplace, for instance?
So there's a difference between accommodating an employee preference, which may be a wise thing to do from a human resource perspective, and actually accommodating an employee's legal rights. And so let me just focus on that if I can, Sasha. So we're talking now about the realm of those who have a legal right to be accommodated. And the first point to make there is that the duty to accommodate, which exists under human rights law, under the Ontario Human Rights Code, the Canadian Human Rights Act, it's triggered only in cases where an employee has a concern with a return to work that's linked to a protected ground under the legislation. And there are really two grounds that I think are most likely to come up that we need to think about. The first is disability as a protected ground. Employees who are vulnerable, particularly vulnerable to COVID, perhaps because they're immunocompromised or they have pre-existing conditions or both, they may have concerns with attending in the workplace as the pandemic is still ongoing, even if numbers drop and so on. There may still be a serious concern there. And similarly, you may have employees who are unable to receive the COVID vaccine for medical reasons. For example, there's some people who have allergies to the vaccines, and there's been some work being done there. And they may also be in that category where they feel because of their health issues that they are vulnerable if they return to the workplace at this time or even in the short term. So keep in mind disability. I think that's one area where you're going to have to be thinking carefully about accommodating. The other is family status. And that relates to significant family responsibilities that an employee has. An employee who is a caregiver to a family member who is particularly vulnerable to COVID-19, for example, an elderly parent, that employee may also be in a position to seek accommodation in the context of a return to work. And also, many employees have had to reorganize and assume personal responsibility for providing care to children or the elderly during the pandemic. For example, many parents lost their childcare or gave up their childcare arrangements during the pandemic. And so they will need time to figure that out because of their childcare responsibilities, which are captured by family status under human rights legislation. So in implementing a return to work plan, employers should provide reasonable temporary accommodation to parents and other caregivers who can't simply just replace their personal care with someone else's care because there are capacity issues, availability, etc. That's going to be something that I think will come up for many employers. Remember that accommodation is an individual assessment. It's based on the needs and circumstances of the individual employee. And in that context, accommodation doesn't necessarily mean continuing to work from home. An accommodation within the workplace is another possible option that needs to be explored. And I'll give you a couple of examples. Ensuring that everyone in the workplace is conforming. Of course, you have to under occupational health and safety obligations, conforming to all the safeguards in place, so that if you have an employee who is unable to wear a mask for a medical reason or unable to be vaccinated for a medical reason, maybe they can be isolated within the workplace or at least better protected if they're prepared to come back to work. And you may also want to consider permitting flexible work schedules and a mix of home and office work to accommodate employees who have care responsibilities that they simply can't just pass off to somebody else easily. Another thing to remember, the test under human rights legislation is to the point of undue hardship. You have to accommodate, but if you hit that point of undue hardship, then your obligation to accommodate ends. But if you've been having your employees working remotely for a significant period of time, it's going to be very difficult to establish undue hardship if an individual is seeking accommodation to work from home. That's going to be a tough one to meet, so keep that in mind. A couple of other things I wanted to raise for everybody, a few other considerations. If you are anticipating, and many large employers will, I think, be anticipating a significant number of accommodation requests that are going to be coming in at the early stages of returning to work, then you may want to review and reconsider your accommodation policy and the process you have in place. So I have clients now who they're planning to adopt a two-stage accommodation approach. They're going to grant accommodation requests to continue working from home in the short term, maybe from now until, say, the end of October, they'll grant those if they are requested. And then after that date, they'll ask for employees to return. And if employees are still seeking accommodations, they'll engage in the normal, more rigorous accommodation approach that normally you would look at, where you'd have supporting documentation and you'd be having an inquiry and dialogue about it. But because of the sheer number they're anticipating, they decided to have this two-stage approach in the short term. The ideal situation is for as many employees as possible to voluntarily return to work. There will be some employees who cannot wait to get back to the office. I call them the enthusiasts. And my clients tell me that they're aware of lots of people who would love to come back. There will be some employees who, for various reasons, would rather continue working remotely. Let's just call them the skeptics. And there are those in the middle, the neutrals, who will come back if requested. They may not be happy about it, but they will come back. I'd encourage full transparency in all dealings with employees, all communications with employees about the anticipated return to work. I think most employers are going to do that. But it's just a reminder, it's a really good thing to do in terms of compliance with occupational health and safety legislation, to have full transparency, dialogue, communication, explaining the extensive safeguards in place, the expectations that will be in place, the accommodations that may be available, encouraging employees to raise issues with their manager, with the director of human resources, other identified members of management, because the sooner that issues are raised and employers become aware of them, the sooner they can be addressed constructively in compliance with legislation, and we can all get on with the reopening and return to work. Last point, the Ontario Human Rights Commission has published a Q&A document available online on their webpage concerning COVID accommodation. I encourage you to take a look at it if you want more detail. I think it's quite well done. Thanks, Sasha.
Thanks so much, John. What I love about your answer and Rob's is, as I was listening to the various things you need to consider and all the content you gave, Rob's voice was in my head saying, and focus on results. Right? So when you're having these discussions and making these decisions, again, if you can bring it back to that performance, at the end of the day, we've got to get results. Are there different ways to get it? And to me, the combined answers, that's where the solution lies. Thomas, I would love for you once again to round out this discussion with your lens. So the research proposes, and both Rob and John have underscored, that the next normal will be a combination of ongoing remote work, employees returning to physical workspaces, and hybrid teams comprised of employees across a mix of different locations. Given this more permanent shift to work styles, is there an implication for organizations' health and safety policies and procedures? So John alluded to some of them, but what else is there? What should employers be thinking about here? What have we missed?
Yeah, great. Thank you. Thank you, Sasha. So I think this starts when you're starting to think about health and safety policies and procedures. The starting point is really a risk assessment, and a risk assessment looking at the activities that employees are undertaking, the locations where they're undertaking them, maybe the makeup and mix of your employees, and one of the starting points of the risk assessment is, I think, a role assessment, and because that will then inform the infection control measures that you need to put in place that I'll talk about in a minute. But that role assessment is really about looking at what roles can really be done from home, then what roles can't be done from home but can be done with good physical distancing, but then what roles cannot be done from home but can't also be done with good physical distancing. So it's three categories of roles that then inform the infection control measures that you would put in place. But then you also have to think about as I mentioned before, the psychological health and safety measures for both at people working from home, but also those coming back into the workplace. And then for the physical workplaces, a lot of workplaces haven't been operated for quite a while, or have been operated at a very low capacity. And so then the question is, what is the reactivating procedures, particularly around maintenance, maybe about air handling issues, to ensure that the physical workplace is up to appropriate standards for people to be working back in that workplace. From an infection control perspective, I think it's also important to think about this in terms of what we'd call our hierarchy of controls, and that hierarchy of controls is an order in which we try to implement health and safety control measures. First off is elimination. If we can't eliminate the hazard, we then try and substitute it for something that's less hazardous. Then we move into engineering controls. And I think in terms of COVID, in a lot of ways, the vaccination really is like an engineering control that tries to eliminate, but it's really more of a engineering control. If we have vaccination as well as various physical barriers and other measures within the workplace having those engineering controls, then we have the next layer, what's our administrative controls, that are around our systems, our work systems to try and manage physical distancing. It could include work teams and pairs of people, creating work zones. Then we're talking about new rules and procedures around how people interact. We're then talking about surface cleaning, maybe managing illness in the workplace, training, and then we move into our PPE, our personal protective equipment, that includes masks and hand sanitizer and the like. And so it's really that it's not a one measure or another, it's really that combination of measures. But from the hierarchy of risk controls, we try and place more emphasis on the higher order controls. So in regard to, focus more on engineering, then on administrative, and then the least effective controls are those PPE controls. And so I think that there's that aspect of, who needs to be in the physical workplace, but who can be working from home, how much social distancing there are, that then informs that, as that combines with that hierarchy of risk controls. And then looking at how do we communicate all of this effectively, and how do we have an appropriate two-way level of communication, but also then how we effectively managing the health and safety of customers and clients as well. So I think there are a broad range of sort of considerations that all impact in regard to the policies and procedures that people will put in place.
Thank you for that, Thomas. And you, at the end there, you mentioned communication, and that could be a whole other webinar in and of itself. I think that piece, we're going to have to get that right. But before, there are questions coming in, so I want to get to those. Before I do, John, I just want to lobby it back over to you. Is there anything that you would add to the policy and procedures discussion, or has it been rounded out enough?
I don't have a lot to add to it. I think what Thomas just discussed is very much in keeping. It's very consistent and relevant to complying with occupational health and safety legal obligations, because occupational health and safety law actually encourages innovation. It encourages pragmatic solutions developed jointly through transparent, open communication. And one of the things that I think we can all agree on is that there's been a lot of innovation and pragmatism that has had to be brought to bear, had to have been brought to bear to issues arising in COVID. And I think that will continue, but it's very consistent with how the law is structured. There's no obvious solutions. There's processes in place trying to identify and address hazards in the workplace, trying to find appropriate solutions for different kinds of workplaces, working jointly with employees, joint health and safety committees, and so on. It's very much along that sort of vein. So I think what Tom said is very relevant and important.
Thank you for that, John. Let's get to the questions, because there are a few really good ones. Rob, I'm going to hand the first one over to you, or the first one's for you. Given what you said about employees mirroring leader behaviors regarding attendance to work, if the boss is in 2 days a week, then their reports would be in the same days. Potentially, this potentially could create a ghost town the other days, right? So if you organize it so that when your boss is in, you're in, and it's a ghost town in the office on those other days, how is Sun Life thinking about this kind of challenge? Is it a challenge, and how is Sun Life thinking about it?
So it's less the ghost town that we're worried about, but I think it becomes a sense of entitlement or regularity that we're maybe more concerned, that it becomes a schedule. So is it always Mondays and Fridays where people are out of office? And is it that type of, because we really want people to come into the office when it makes sense for them to come into the office. And I'm not sure thinking about it being a ghost town is really the priority for us. It's more of, again, what makes sense for you, your colleagues, the work that needs to get done. We have had conversations with the leadership about them making a commitment to work remotely when it makes sense for them as well. And I believe that that's currently our intent. But what's important is we're going to have to learn through this by practice. Our leaders have been successful working remotely. We have virtual workforces already. Our three major offices in Canada are Montreal, Toronto, and Kitchener-Waterloo. We have teams that jointly work across those. So even in the office, most of our leaders will have people on a call joining. And what we have found is it's actually in many ways more effective for those people not in the main office over the last year. So for us, it becomes sort of, I've deviated from the question a bit, but our fear isn't it being a ghost town. Our fear is more that people will think that physical presence gives them some sort of advantage, or it's a behavior that's going to be rewarded. And how do we move away from that so that the people, if a leader's in Toronto, how do the people in Montreal, Kitchener-Waterloo, or another location feel that they're fully included? Because in fact, they have felt more included in the last year than they did previously. So it's how to preserve that while still getting the benefits. Aware of the problem, and we'll be testing different solutions out and innovating as we go forward.
That's really interesting. Thanks for that, Rob. There are a couple of questions about the vaccines that I'm going to give over to John, but before we get there, can you all still hear me? Rob, I can see you. Can you hear me okay? Okay.
I hear you.
Thomas, I have a question for you before we get to a couple of vaccination questions for John. So Thomas, do you have any practical tactics or suggestions of things employers or managers can do to ensure that employees feel safe, to live the safety culture?
My sense is that supervisors and in essence team leaders are really the key safety people in an organization, because they're both modeling it for the people in their team, but they're also the conduit up to higher levels within the organization. So I think it's really, the role of the supervisor and team leader is really important. And so my sense is that it's their ability to connect and to really understand what's happening with their employees, and particularly those working from home, and the stresses that they're dealing with, and that the ability to ensure that people are appropriately supported is really important. So I would say sort of, a practical thing is about supervisors really being connected and communicating effectively with all of the employees within their work teams to really work out where people are at and what they're dealing with.
Thanks for that, Thomas. John, I'm going to ask you a couple of questions that have come from the audience related to vaccines. So the first one is, can employers make having a vaccine mandatory prior to return to the office? And then a broader question from several members of the audience. You mentioned privacy in relation to vaccine requirements. Can you explain this requirement more? Can employers ask if their employees have been vaccinated? Can they mandate the vaccine?
Wow, I have to admit, I fully expected that series of questions to be asked. So let's see I'll try not to make this a long legal lecture. Let's see if I can hit the high points in terms of the whole issue of mandatory vaccination. I think there's been some confusion in this area because many of the actual decisions or cases that we've had that touch on issues of mandatory vaccination actually have come from unionized workplaces where arbitrators have been interpreting collective agreements and they've issued decisions, particularly in respect of the flu, that have said that employers can't require flu vaccines. Keep in mind, these are the same arbitrators who regularly reinstate unionized employees who, have stolen from the employer or have committed fraud against customers. I mean, that's just the nature of just cause under collective agreements. And it's a very, very different world when you move beyond that to the non-unionized environment. So I think, I operate in both and I represent clients who are both unionized and non-unionized. And I realize that there's a huge divide in the legal analysis between those two groups. So I think that's the first thing I want to say. I think there might be some confusion about the overall legal answer here because so many of the cases we've had have been from labor relations arbitrators. So in the non-union context, let me focus on that. The issue of mandatory vaccination can be looked at from a human resource management perspective. Is it a good thing to do? Is this appropriate for your workplace? Is it going to encourage employee morale and productivity? Could it backfire and be viewed very badly by employees? These are all human resource issues, I realize. But there's the legal perspective. And legally, the issue in the non-unionized context is rather novel. There are, as far as I know, very few cases, if any, on this issue outside the unionized workplace. And there are very few concrete limits in the law on employers having these kinds of policies and enforcing them. And in fact, occupational health and safety legislation appears to provide a principled basis for having a vaccination policy in place. Employers have a positive obligation to take all reasonable measures to protect employees in the workplace to ensure health and safety. We know that COVID can be spread asymptomatically, i.e. before a carrier even knows that they're sick. And we also know that while no vaccine is 100% effective, vaccines strengthen the immune system and allow a person to fight off COVID more quickly if they become infected, so they're less likely to spread it. And I constantly am looking at what various health authorities are saying, and the CDC has been saying for quite a while now that based on the science, getting vaccinated prevents an individual from spreading COVID and protects the people around that individual. So that would apply in the workplace. So the science suggests that there are good reasons from an occupational health and safety legal perspective to be looking at this issue and thinking about it carefully, because it does seem to have some scientific factual basis for protecting workers in the workplace. Now, there are some legal issues that you should absolutely keep in mind that may, in fact, create some restrictions. First is discrimination law and human rights. I've already talked about the duty to accommodate in a different context, but you may have individuals who, for health reasons, cannot become vaccinated. They're allergic to the vaccines, for example. There are also certain groups with religious beliefs that have to be accommodated that don't believe in having the vaccine. So in those cases, you do have legal obligations to accommodate, and you're going to have to go through that whole process where you have a legitimate accommodation claim from someone who can't be vaccinated. And then there's privacy law, and this is the sort of the issue that comes up, Sasha, in the second question that you asked. Requiring vaccination certainly engages privacy law. You're requiring a person to put a medical product in their body to have a vaccine administered. And you're then, as a condition of their employment, I mean, no employer is forcing someone's arm, and stabbing a needle in it. We're talking about making it a condition of employment that they have a vaccine. So you're requiring them to take this medical product, and you're then collecting personal information, because it seems to me that you can't really have an effective policy unless you have employees tell you whether they're vaccinated or not. So you're getting health information about those employees. You're going to have that information safeguarded. It's personal health information. There are certain rules around it in privacy law to keep it secure, to keep it confidential. And so, that's important. But also keep in mind that privacy laws differ from jurisdiction to jurisdiction in this country. And that's another important factor. If you're federally regulated, and some attendees on this call may well be in the financial services sector, then you're subject to PIPEDA. And that requires the collection, use, and disclosure of personal information to be reasonable. Based on the current science and the context of a global pandemic, it may actually be found to be reasonable to have a vaccination policy, but PIPEDA does govern it, and that's the framework you have to think about when you're dealing with these kinds of issues. There's no legislation like PIPEDA that applies to provincially regulated private sector employers in Ontario. The common law tort of invasion of privacy may be available to assert claims against an employer if an employee feels their privacy has been invaded. But the current legal test is that the privacy invasion has to be highly offensive based on how the courts view these sorts of things. And it's unlikely, based on the current science in the context of a global pandemic, that a court is going to find that a vaccination policy is highly offensive. So I think that may not be a very strong basis for limitations. There's also wrongful dismissal law and the whole question of how courts will view someone if they were to refuse to have a vaccine and you then took the step of terminating their employment as a result. A court may well view that, well, a court would view that as wrongful dismissal, but it's unclear what the damages might be. Could there be aggravated damages? Could there be punitive damages? These are issues that we always face. Every employee who is fired claims for punitive damages and aggravated damages, so it's always part of the analysis. Those damages are typically only awarded in exceptional circumstances, and it may be a bit of a stretch to argue that a vaccination policy that is supported by occupational health and safety legislation would be in the category that would attract those kinds of exceptional damages. So that's a bit of an overview. It's you can see it's quite complicated. But if you're coming at this more from the human resource perspective, i.e., is it a good thing to do, or if you're risk averse from a legal perspective, because there are uncertainties here, then you may want to adopt the carrot approach, which is what many of my clients are actually adopting. They're not going the direction of mandatory vaccination policies. What they're doing is they're permitting employees to continue working from home for a limited period of time to some extent. They're providing education resources to employees who may be vaccine hesitant, answering their questions, making sure they get any information they feel that those employees need. And they're implementing vaccine incentive plans, providing additional time off work for employees to get their vaccines or recover from the side effects. Some employers are even offering bonuses and other kinds of incentives to get their employees to decide to become vaccinated. So I think there are a lot of different options available in the short term. But frankly, I think there's a strong argument that occupational health and safety legislation, in light of the current science we understand about vaccines, would provide a basis for a vaccination policy in most workplaces.
Thanks for that, John. I'm interested in.
I just need to add one thing, Sasha.
Yeah, I want you to weigh in here. Yeah.
I think there's a couple tricky things here. And where we were previously, before, and I think this is where, as new variants come out, things will change, new variants of concern. One of the things that concerns me is that we were probably close to herd immunity before the Delta variant. We thought that was achievable. But the recent sort of science in the last couple of weeks is that with the Delta variant, we likely are going to be looking at an 85% vaccination rate for herd immunity. And I believe we have more vaccine hesitant people than 15%. And that starts to become a challenge where if we're thinking back a couple months, we thought 70% might be good. And so one of the things we've often focused about is the people who don't want vaccines and how to accommodate them. But there's also what's the, how safe do the other 75, 80% of employees who are vaccinated, but that's still a risk, and they're being forced, or they perceiving they're being forced to come back to the office or need to come back to the office and sit next to people who are unvaccinated. And we're putting them at risk. And whether we can legally do that, that's different than whether we can morally, or the impact on their engagement and their mental health, their feeling that the company's protecting them, and where that's actually the vast majority of employees may feel that this is not, we're not protecting them. And this for me becomes the most difficult area of balancing those individual preferences and rights versus a large majority of the workforce who are vaccinated and maybe feel that they're being put upon by a small minority that doesn't want to be vaccinated. And so I think that's going to be both human resources, messaging, an engagement. It's just it's a fraught area. I don't think that's going to be solved, and it's going to change with the underlying medical situation as well.
Thank you for that, Rob. And we only have a couple minutes left, but Thomas, I'd love for you to just round out then this whole piece about the vaccination. So we've heard about the legal implications, we've heard about the HR implications. What are your thoughts? What do you want to add to this before we move off this topic?
Yeah, I think from my understanding of the health and safety legislation is that it does provide employers a basis to have a policy in regard to vaccinations or requiring vaccinations, but that's different to how do you enact that appropriately and effectively and equitably and everything else. So one aspect is do you have a legal basis? The other aspect is how do you do that effectively? As Rob said, that the science is changing in regard to the with increasing variants of concern, and how effective are vaccines against those. Obviously the Delta variant we're worried about at the moment, but I'm sure that there's going to be other variants that are going to come through, and that then the question is how effective are the vaccines against those ones. So I think that it's an ongoing moving feast in regard to what we know and how best to ensure the health and safety of workers, but definitely vaccination and having as many people vaccinated within the workplace is one measure as part of the range of hierarchy of controls that I think is an important measure to have in place.
Thank you for that, Thomas. I would really love to finish off. I'll do 30 seconds at the end, but it's just been so incredibly valuable, all these different perspectives. We absolutely can't get away from the legal has been so helpful to me, because it's kind of everything's grounded in that. And then you think about, okay, if these are the legal considerations, then what do we overlay to come up with the right solution? So I really appreciate that perspective, and the public health and the employer perspective. If all of you, we have like 30 seconds, what would be your one piece of advice, closing advice to the HR folks on the line of thinking about their return to work planning? What would you say to them if you could say one thing to them? John.
Maintain and promote a culture of transparency and open dialogue and communications. My clients who have been most successful, and many of them have, and I bet Rob's a great example, have been so effective in that area, and it has paid off. Everyone understands what is happening, are supportive of what is happening. People are, cheering for the organization, wanting it to succeed. And I think that has been key from what I have observed. And it's very, very helpful, because it helps you to comply with occupational health and safety obligations too. So you can't lose.
Absolutely. Thanks, John. Thomas, parting words.
Yeah, I think, even though most of the focus is on controlling COVID and thinking about it as an infection control issue, we think we have to think about this more broadly and the broader health and safety issues. And again, as John was saying, that from a culture perspective, it's how are our organisations able to ensure us and maintain a safety culture moving forward as well. Thank you.
Thank you, Thomas. And Rob, send us off.
Well, I agree with the transparency and communication, but if I were to add one thing on that, I think there's a reminder that we've come to a bit of a new normal. We've been relatively successful over the last year and a half, and the new ability to work remotely, which many employees, not all, but many employees value, taking that away will have a bigger psychological effect than when people started working virtually. Taking something away from people that's become their new normal will be a challenge for all employees or employers, possibly legally, but certainly from an engagement and an employee retention perspective.
John, Rob, and Thomas, it has been a privilege to host you all. It's been a fascinating discussion. I think it's going to be the first of many many conversations going on in the sector as we speak. So thank you so much for spending your time with us and lending your expertise to this. Audience, I hope that you found this discussion valuable. If you are leaders in your organization planning return to work strategies, hopefully you've learned something new in this session, or at least it's validated the paths that you're on already. And if you're employees listening in, I hope that at a minimum, you're comforted by the fact that there are discussions going on, that people are really thinking about this very thoughtfully, and they're really considering, the decision makers are really considering how to do this most thoughtfully and with your well-being in mind. So with that, again, John, Rob, and Thomas, thank you so much for joining us. I hope you all have a great afternoon. Goodbye.
Thank you, Sasha. Bye-bye.
Bye.